Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm so glad you're joining us today. In recognition of Colon Cancer Awareness Month, we're discussing an important and concerning trend in colorectal cancer, the rise of cases in young adults. Colorectal cancer is now the leading cause of death in the United States for people under the age of 50. For many years, this disease was thought to primarily affect older adults, but that perception is rapidly changing as more younger people are being diagnosed. Today, we'll talk about why this trend may be increasing, what symptoms people should watch for, when to consider screening, and most importantly, what steps you can take to protect your health. Whether you're a patient, caregiver, clinician, or simply someone interested in learning more about your health, we're glad you're here. If you'd like to learn more, stick around, share this broadcast with your friends and family, and ask your questions in the comments below. We'll answer as many as we can during today's discussion. I'm pleased to introduce our panel of expert colorectal surgeons joining us today. Dr. Preetha Ali, Dr. Brian Bello, and Dr. Zhifei Sun. Thank you all for joining us today and for sharing your expertise with our viewers.
Thanks for having us.
Thanks for having us.
Thank you.
Of course. Before we get started, can you tell us a little bit more about yourself and what you do here at MedStar Health? I'll start with you, Dr. Ali.
Sure. So my name's Preetha Ali. I'm a colorectal surgeon at MedStar Washington Hospital Center. I have been practicing colorectal surgery since 2014, but have been with the MedStar system since 2022. I am from the Maryland, DC area, and so I'm very happy to be taking care of patients in our community.
Thank you very much. Dr. Bello?
Hi, everyone. I'm Brian Bello. I'm the Regional Chief of Colorectal Surgery, mostly at MedStar Washington Hospital Center and MedStar Montgomery Medical Center. I've been with MedStar Health for more than 10 years. Happy to be here giving the public some education about colorectal cancer.
Thank you very much. And lastly, Dr. Sun?
Hi, everyone. My name is Zhifei Sun. I'm a colorectal surgeon here at MedStar Georgetown University Hospital. I've been with MedStar since 2021, and before that, I was at Duke and WashU for my training. And happy to take care of folks in the community, and have been for a number of years here.
All right. Thank you so much. Let's begin by talking about the big picture and what physicians see with colorectal cancer in young adults. Dr. Ali, I'm going to start with you. For many years, colorectal cancer was considered a disease that primarily affected older adults. When did you and your colleagues begin noticing a shift toward younger patients?
So I would say it's kind of been a more gradual increase, probably since about the 1990s, with seeing a more dramatic impact probably in the early 2000s, where we started to notice almost year after year about a 1 to 2% increase in patients kind of under the age of 50, basically. And in the last, I would say kind of in the 2010s, we noticed it was even more than that, almost like a 3% per year increase in the number of cases per year. And so we noticed overall that there was about in the less than 25 age group, there was almost like a 5 to 6% increase. So that particular age group, we saw the greatest increase in the number of younger onset cases of colorectal cancer.
All right, thank you very much. And are the cancers we're seeing in younger adults biologically different or potentially more aggressive than those diagnosed in older patients?
So definitely an area that's still being studied in more detail, but it is actually what we're seeing is that it is a biologically more distinct entity in that on a molecular level and even even the cell types that we're seeing in these cancers are slightly more aggressive. Even the location tends to be more commonly on the left side versus on the right side in older patients. So we are seeing some differences in even what it looks like on a biologic level and even just on a clinical level as well.
Wow, thank you very much. And We know younger adults are often diagnosed at a later stage. Why do you think that's happening?
So I think one of the biggest issues I think that happens in younger patients is that there's this even subtle signs get missed, right? Like sometimes you have a little bit of rectal bleeding and you're told it's just your hemorrhoids, or if there is abdominal discomfort that feels kind of out of the norm, then it's sort of, oh, maybe I just have some stress IBS type symptoms. So it's very easy to kind of ignore some of the signs. Oftentimes it is fairly silent, and our screenings don't really start until age 45. So I think it's a combination of sort of multiple factors that makes it seem like it's a we're they're getting diagnosed kind of at this later stage, mostly because we're ignoring some of the signs and symptoms, chalking it up to something else, and our screenings are just starting at age 45 per our current guidelines.
All right, thank you very much. And I know we'll talk about screening a little bit later in the discussion. Let's talk now about risk factors and possible causes contributing to the rise in early onset colorectal cancer. Dr. Bello, I'm going to go to you next. There's been a lot of discussion about the role of so-called Western diets, which tend to be high in processed foods, red meats, and sugary beverages. How much might diet contribute to this trend we're seeing?
We're seeing a lot of risk with these types of diets, especially with red meats, low fiber diet. We're seeing with if you have a diet high in red meat, even if it's one serving a day, that your risk will go up to 15 to 30%. Conversely, if people have a high fiber diet, the diet that's rich in fruits and vegetables, we're seeing a decreased risk, about a 10 to 20% decreased risk of colon cancer. So there's definitely it's definitely a risk factor for colon cancer.
All right, thank you very much. And there's also been a growing interest in the gut microbiome, which is our body's internal community of bacteria. Is there evidence that changes in the microbiome may be linked to early onset colorectal cancer?
Definitely, we're seeing that the diet that you have, especially early in life, especially the ones that we just discussed, a low fiber diet high in red meat can trigger different types of bacteria, and that can cause a chronic type of inflammation over the years that can increase cancer risk. So we're seeing that diet can definitely shape the microbiome, and keeping those types of foods away, especially when you're younger, can help improve your colorectal cancer risk overall. So these ultra processed foods like salty potato chips, fast food, frozen meals, anything that has a lot of ingredients in the descriptions, processed meats, packaged snacks, those are all ultra processed foods and not good for you.
That makes sense. And you mentioned starting that earlier in life can help support a healthy microbiome later in life.
Definitely. And also with the microbiome, we see that antibiotics that you take early in life can affect your microbiome. So we encourage people not to take antibiotics unless it's really needed, unless it's definitely recommended by a physician.
Thank you. That's good to know. Um, how much of early onset colorectal cancer is related to genetics versus cases that occur without a family history?
So we're seeing some of it, a lot of colorectal cancer in young onset or older is still genetics. Um, the if you have a family history of colon cancer, that definitely increases your risk. If you have a hereditary syndrome such as Lynch syndrome or FAP, that's a condition where you have a lot of polyps, those increase your risk of colon cancer. But the vast majority of young onset colorectal cancer is still sporadic, meaning you can have no family history, no hereditary syndrome, and still have colon cancer.
All right. Thank you very much. Let's talk about symptoms now. Many younger adults may dismiss symptoms or assume that they're related to a less serious condition, like we talked about earlier. So, Dr. Sun, gonna go to you. Many young adults attribute symptoms to issues like we said earlier, IBS, hemorrhoids. When should someone stop waiting and seek evaluation from a specialist?
Yeah, I think that's a very common scenario that we hear about. I think if symptoms persist beyond a few weeks, especially with rectal bleeding, changes in bowel habits, or unexplained abdominal pain, I think it's important to seek evaluation, either through your primary care physician or a gastroenterologist. The key message here, I think, is don't ignore them. Just, if your symptoms are persistent or progressive, I think it's important to get evaluated.
All right, thank you very much. You mentioned rectal bleeding or maybe even thinking about what other, situations would happen when you are going to the bathroom.
Yeah.
Is rectal bleeding ever considered normal for someone in their 20s or 30s?
No, I think any rectal bleeding should be monitored at least. While internal hemorrhoids are a very common cause of rectal bleeding, um, you know, persistent or progressive rectal bleeding should never be assumed to be benign, especially if it's associated with other concurrent symptoms such as, changes in the caliber of your stool, progressive bloating, early satiety, weight loss, etc.
All right, thank you very much. What about less obvious symptoms? Are there any that would be something that our viewers might not realize that's important for them not to ignore?
Yeah, great question. It's easy to see blood in your toilet bowl, but some of the actually more commonly diagnosed sort of ways it comes to us is from unexplained anemia, which can cause sort of chronic fatigue, early satiety, sort of feeling that you're getting full very easily, associated with bloating, and maybe even subtle changes in your bowel habits. Some of these can be non-specific. It can be related to occasional variations from what you're eating, your water intake. But again, I think the key theme is that if the symptoms are persistent and progressive, it's important to seek evaluation.
Thank you very much. What about the stool? We mentioned bleeding, but is there anything else you can see in your stool itself? People sometimes hear about pencil thin or narrow stool as a warning sign. Is that concerning, and what does that mean?
Yeah, so the symptom, the ultimately pencil thin stools makes people think about an obstruction related process, and we do see that when there's progressive changes in the caliber of their stool. Occasional variation, of course, is can be normal just from what you're eating that day and your hydration level, but persistent changes and when people have more significant narrowing, actually some of those caliber changes turns into more of a diarrhea symptom from what we call overflow diarrhea, meaning the solid components are getting stuck, but only the liquids are getting through. So you're getting a paradoxical diarrhea kind of symptom. Again, if all these symptoms are persistent, it's really important to get it checked.
All right, thank you. And if a patient feels their concerns are being dismissed, so they have these symptoms that we're talking about, they talk to maybe their primary care doctor at first, maybe not a GI doc initially, and maybe they're hearing, I'm too young for cancer, or they're even thinking that themselves. How can they advocate for themselves? And are other areas outside of gastroenterology, other specialties like primary care, aware of this trend in younger adults?
Yeah, I think, especially with efforts such as, this Facebook Live, awareness is improving, not just among the physicians, but also in the general public. Um, there's still definitely some variability, and I hear some of the same complaints that you've just mentioned there. I think patients should definitely feel empowered to advocate for themselves and push for a more in-depth evaluation and seek a referral to a gastroenterologist or a colorectal surgeon to work up some of those symptoms. And I think it's very reasonable, especially with the increase in incidence of these young onset colorectal cancers that, seeking out a colonoscopy would be very reasonable, in my opinion.
All right, thank you very much. We talked about a lot so far, and we have more questions as we look to screening, prevention, treatment. But thank you for answering questions about what is happening, what are the risk factors, and what do our viewers need to think about as they look at what's going on in their life and talking to their clinical teams. Just want to remind everyone, if you have any questions, please ask them in the comments. And if you haven't already, give us a like. Let us know you're watching. Let us know where you're coming from and share this broadcast with your friends and family. Like we just said, it is very important that we spread awareness of colorectal cancer and how this trend is rising in young adults. So thank you for helping us to share this message. And we have more questions to get to now. And we're going to talk about screening and prevention. And Dr. Sun, I'm going to keep talking to you. Um, we did a recent national survey with 1,000 US adults. And that survey found that more than 75% of Americans are unsure when or how often they should get a colonoscopy. In 2018, screening guidelines lowered the recommended starting age from 50 to 45 for average risk individuals. Do you think that change is enough, or might the screening age be lowered again in the future?
It's a great question. I think it's definitely a step in the right direction, but given how many of these young onset colorectal cancer patients we're seeing, it may not be sufficient. There might be a way to risk stratify based on certain clinical and demographic factors rather than a single age cutoff as a future research direction. But there's many factors that comes into making a recommendation at age 45. But I think we'll see that may change over the next 10 years.
All right. Thank you very much. Some people are curious. So we have colonoscopies that are performed at our facilities. There's also at-home stool tests or blood tests. Are these as effective as a colonoscopy for younger adults? And why or why not?
Yeah. So stool tests can be helpful for average risk screening, but they're not as sensitive as a colonoscopy for detecting smaller or sometimes even more advanced polyps. So colonoscopy really remains the gold standard because it allows for both detection and removal of those polyps, thus preventing cancer transformation. So, if a patient has symptoms that are concerning, I think stool tests are probably insufficient for if you already have symptoms, and pushing for a colonoscopy would be a reasonable approach.
All right, thank you. Can you talk about those that do not have symptoms? So we talked about 45 being the recommended starting age for people without symptoms or family history. When should screening begin for someone who has symptoms or a family history? And do these other tests, are they as effective for that group of people?
Yeah, so with symptoms, I think evaluation should happen at any age. But those without symptoms or with a family history, typically the recommendation is 10 years earlier than the youngest relative with the diagnosis, or by age 40, whichever comes first. So understanding some of your family history is also important to communicate that with your primary care physician, GI docs to consider screening at an earlier age.
All right, thank you very much. Can a colonoscopy prevent colorectal cancer, or does it primarily detect the cancer once it's developed?
I think the answer here is unequivocally yes. This is colonoscopies can definitely identify and remove precancerous polyps and effectively preventing cancer from developing. So it's not just a diagnostic tool; it's almost always, many times a therapeutic tool. that keeps a advanced polyp from turning to a cancer, avoiding a cancer diagnosis, avoiding a surgery down the line.
All right, thank you very much. Let's talk about treatment now. I'm going to go to Dr. Ali and the treatment and what physicians are doing with our younger patients. So, Dr. Ali, when you see a younger patient with colorectal cancer, are they often diagnosed at a more advanced stage? And how do you start talking to them about their treatment options?
Yeah, so they do tend to be in more advanced stages. Oftentimes, we are seeing some of these patients in a stage 3 or even a stage 4 disease, but it doesn't necessarily mean that they have worse survival. So these groups tend to, because they're younger, they tend to be able to tolerate the therapy. They're not as they don't have other sort of medical conditions that could make things difficult in tolerating treatment. So we have found that overall they actually have a very good survival when we are able to get them to treatment in a timely fashion. And so it's part of the reason that, for example, like not ignoring the symptoms are so important, because if we're able to get to these patients at the right time, then we're able to treat this disease.
All right, thank you very much. Are there patterns you see among younger adults, such as delayed evaluation of symptoms or cases where there's few symptoms at all? Do some of these patients have more of a family history or genetic risk? What type of patients are you seeing and what background do they have?
So I would say most of the time in some of these younger patients, it's that they have ignored the symptoms, right? They may have had kind of scant amounts of rectal bleeding, or just kind of said, "Oh, it was because I ate something. Whenever I eat this, I get a little bit of rectal bleeding." And so I think it's easy to sort of, oftentimes younger groups of patients are not always going to their primary care physician, like even once a year, every 6 months, right? You're not getting your physical exams as annually as maybe we should be. And so it's very easy to kind of go to your friends and family and be like, "Oh yeah, I had some hemorrhoids and I had some bleeding." So I think it's really just trying to stay attuned to those symptoms that are feeling unusual. Like, for example, if you feel like you're losing weight but you're not really sure why, it's happening, you're eating fine, exercising fine. I think sometimes people will chalk it up to say, "Oh yeah, I went on this diet and I really kind of changed I changed the way I was exercising." But if it seems like it's dramatic or more than you anticipated, those are all kind of subtle signs and symptoms that we should pay attention to. So I think a lot of it is just really being aware of, those tiny things that maybe we kind of just chalk up to something else, but really could be a very clear sign or symptom.
Makes sense. Thank you. Can you talk about treatment planning? How does that occur especially with our younger patients? Are there different treatment options for younger patients, or do you approach that a little bit differently, especially when you're thinking about fertility prevention or long-term quality of life?
Yeah, so there's in earlier onset colorectal cancer, there's so many considerations, like especially because most of these individuals are kind of in their career building phase or family planning, kind of they're the social networks that they have are still sometimes evolving. So from a family planning standpoint, there's always, especially in rectal cancer, we're always thinking about considerations for pelvic radiation. How will that affect fertility? I mean, there are options for addressing these. And so those are all discussions that are really important that we have early, in terms of, like, for example, sperm preservation or egg preservation. Like, how do we protect those ovaries, or even, suppress them if we need to for a period of time? Certain chemo meds can cause toxicity to certain organs. So surgery can affect your nerves. And so we are having those discussions kind of very early on, because it's all part of the treatment planning phase. We're doing a lot of counseling about sort of what the impact is on sexual health. Like, do we need to talk about pelvic floor physical therapy kind of early on? And I would say one of the biggest impacts is probably even financially for these patients, right? Like sometimes it's not as much the health insurance may not be as robust, or they have to take time off work, so there can be sometimes even a financial burden from loss of income or things like that. So it all of those things are part of the planning process when we are thinking about treatments and sort of what we do leading up to treatment, even so that in the post surveillance phase, it's not, too burdensome. One of the things that we find with this patient population is anxiety increases, right? You kind of feel isolated from your peers. You're having to sort of, struggle with things like, how do I manage my treatment in the midst of childcare? All of these things are considerations when we are, talking about a treatment plan that can be individualized and how best to sort of support this group.
All right, thank you very much. Yes, lots to consider. Let's talk about go back to we talked earlier about risk factors. Dr. Bella, I want to go back to you to talk about what people can do to lower their risk. And speaking of risks, we did get a question from our audience. This is from Nick. Thank you, Nick, for your question. His question is, are microplastics a cause for the rise in cases in younger people?
There's definitely evidence suggesting that. This evidence is evolving, so there's not direct recommendations yet, but I think we can say there is some benefit from exposure to this, especially early in life. The foods that are packaged in plastics, heating these things that have plastics on them in the microwave. There's also microplastics in the air we breathe and the water we drink. It's emerging. There's probably a link, is probably what it's going to come down to with the research. But it's probably a combination of multiple things, microplastics. We talked about healthy diet, having a good, healthy, high fiber diet would be preventative, especially when you're younger. So encouraging parents to give their children a variety, fruits, vegetables, nuts, seeds, not just a meat-based diet. And then really limiting the processed foods like those packaged snacks, sugary drinks that everybody likes, those high energy drinks. We have to be really careful with that. Fast foods, those instant soups, some of these flavored yogurts, some of those are, if you just look at the ingredients, the packages, the ingredients are so long. So trying to at least limit that, cutting down would be good. We talked about exercise a little bit, so encouraging your children to do 20 to 30 minutes of activity each day, which is probably preventative. And again, avoiding those unnecessary antibiotics, not necessarily seeking those out. Sometimes those have a important role in the microbiome.
All right. Yeah, thank you. Let's go back to the exercise recommendation that you made. How much can regular exercise and maintaining that healthy weight reduce someone's risk?
It'll reduce the risk of almost everything, including colorectal cancer, other types of cancer, heart disease, stroke, etc. So staying active, staying at your healthy diet, staying at your healthy weight, and talking with your primary care doctor about goals is very important.
All right, thank you. And some of that exercise could be done outside, where you can get some vitamin D. What role, if any, does vitamin D play in colorectal cancer risk or prevention?
There's definitely a link to if you have vitamin D, that it can be preventative. So we encourage people to be outside, exercise outside, especially again at a young age, can be preventative.
All right, thank you. And I'm sure we have many parents watching, wondering what they can do to help protect their children's long-term health. You mentioned exercise, you mentioned diet. Any other habits or lifestyle choices families should focus on early in life?
I think we hit all the high points. I would say just also visit with your primary or your pediatrician and seek advice from them. And again, I think we discussed, Dr. Sun mentioned, don't ignore your symptoms. If somebody has bleeding that should be worked up, I think we're all seeing as providers, we're always alarmed when we have a young patient with colon cancer. You're not too young to have it. You should advocate for yourself. If something feels off, you should get it checked.
And colonoscopies are not scary.
Absolutely.
I think people worry about bowel preps. In my opinion, colon cancer is way more annoying than doing a bowel prep. So, if we can kind of keep, just remember that, why we're doing it, and it's really not such a terrible process. We are able to kind of help you through all of those, different steps. To not be scared of having to do one if you needed to.
Yep, thank you for that. Um, Dr. Bell, we talked about exercise, regular exercise. Can you state again, when we talk about regular exercise, how much of that are we talking about per week, per day? Is, you know, how does a sedentary lifestyle play into your risk factor for colorectal cancer?
Yeah, I think definitely now in 2026, many people are at risk. Many people have jobs and they're sitting 8 to 10 hours a day in front of a computer. We're sitting in front of a computer now. So it's important to at least get up every 30 to 60 minutes. In terms of the exercise, it should be really 20 to 30 minutes a day. So 180 to 210 minutes a week. The more you get your heart rate up, the better. But actually, anything is probably better than just being sedentary the entire day, and then being consistent about it.
All right, thank you very much. And going back to the point about healthy weight, how would someone know what their healthy weight is? Is that done through your BMI calculator, or is it a conversation you have with your primary care doctor?
It's definitely all of the above. I think always see your primary care doctor, because uh, if you just Google some of this, there might be some wrong information. But BMI is pretty objective. But definitely seeing your provider at least once a year and talking about weights is good.
And those definitions change quite a bit as to what's considered like a healthy BMI. Like some data will say, BMI less than 25 is considered healthy range. It's not always sort of the average BMI in the US. But kind of maintaining a healthy BMI in really also and maintaining a regular exercise regimen can really overall, those two, optimizing both of those can overall even decrease your risk of these GI cancers.
All right, thank you very much. We have some additional questions from our viewers. We have one from Ray. Thank you, Ray, for your question. Has there been any evidence that alternative sweeteners such as aspartame have found to be a contributing risk factor?
For me, I don't know the direct link, but I'm gonna guess it's there could be something there, especially with long-term use. Um, I think using natural things like non-preservatives, etc., would be generally good advice.
All right, thank you very much. We have another question from Molly. Um, Are we seeing more of this occurring in the United States versus other areas of the world?
So we're seeing it in other countries as well. There is a lot of European data, even on early onset colorectal cancer. It's seen an increase in Canada, but we most of obviously the data that we have is in the U.S. But there is we're seeing it across the board, not just here in the U.S.
All right, thank you very much. And a question from Sharon. Thank you, Sharon. She would like to know if GI doctors and surgeons are learning and providing information about LARS, which we did not cover today, but LARS, I'm sure I know you guys know, but LARS for our viewers is lower anterior resection syndrome. I think that's related to surgery. perhaps? Yeah.
So we talked a little bit about how we counsel them on kind of what how surgery can affect like nerves, muscles, things like that. And so those are all really part of our conversations actually in every population that we're operating on because it's part of our preoperative counseling as it can be, sometimes it can affect overall quality of life. So we talk about balancing those risks and benefits with sort of, taking care of the cancer via surgery, but also understanding kind of what that can look like in the post-op period. So we do actually spend a lot of time counseling our patients, especially when these are sometimes lower tumors in the rectum and such, as to what we can do to what we can anticipate, and what we can even do afterwards from a treatment perspective, to try to help to curtail some of those symptoms.
Yeah, as part of our preoperative counseling, we always talk about the risks, the benefits, the alternatives to an operation, and then but beyond the sort of the legal sort of stuff around that, also just expectations in the post-op recovery period, and not only in the first 30 days, but also first 6 months, 10 years from now. Those can have a lasting impact in our patient population, and that's sort of part of our complete preoperative counseling. So, um, LAR syndrome is certainly a very important part of that.
In,
Thank you very much.
oh, and in addition, there are some options now where we take care of rectal cancer without surgery to help avoid LARS altogether. So sometimes we can do chemotherapy and radiation alone, and then that sometimes can get us to a non-operative plan. Also, there are newer treatments like immunotherapy and certain um, types of rectal cancer where you get that treatment, and again, no surgery is needed. So that's part of it. And both at MedStar Georgetown and MedStar Washington Hospital Center, we have those treatments available.
Great to know. Thank you so much. Great question. Um, those are all the questions that we have today. I do want to ensure that we talk to our experts about any final advice or key takeaways that we want to make sure our audience gets from today's discussion. There was a lot of wonderful information, but if there's one thing or a couple things that you'd want to make sure that our viewers take away from today's discussion, what would that be? Let's start with you, Dr. Sun.
I think early detection really saves lives, so it's important to listen to your body, advocate for yourself, and don't ignore persistent and progressive symptoms, regardless of age.
That's great. Thank you. Dr. Ali, your thoughts.
Along those same lines, really important to try. I know, especially in our younger groups, it's easy to sort of want to eat on the go, and we have busy lifestyles. I think really taking the time to make sure that we optimize our diet and exercise as best you can, just for overall health, is really important. And just making sure that don't be afraid to talk to your primary care if you have symptoms that seem concerning or just something that seems out of the norm for you, because it really could prevent something worse down the line.
Yeah, thank you very much. And Dr. Bello, your thoughts.
I think my final take home lesson would be that prevention starts in childhood. Encouraging people that eat a healthy diet, a varied diet, avoiding preservatives, ultra processed foods, encouraging exercise helps eliminate a lot of problems down the road, not just colon cancer, but different types of cancer, prevention of diabetes, heart disease, establishing good habits. A lot of that starts in childhood.
Makes sense. Thank you very much. Those were some wonderful final thoughts. And that ends today's live discussion. I'd like to give a big thank you to our experts, Dr. Ali, Dr. Bello, and Dr. Sun. Thank you for taking the time to share your expertise. And thank you to everyone who joined us and asked questions. As we said in the introduction, raising awareness about the rise of colorectal cancer in young adults and encouraging people to recognize symptoms and get screened when appropriate can help save lives. If you'd like to learn more about colorectal cancer screening or treatment options, you can visit the link in the comments. Thank you very much for joining us today and have a great afternoon.
Thank you.
Take care.